So you're looking at your patient and something has changed. You look up at the monitor and you see this weird, funky rhythm in front of you. What do you do? Well, first of all, let's diagnose what kind of rhythm it is. So I'll give you a second. Three, two, one. What is it? Torsades, right? So this is called torsades or torsades de pointes. Now, what does that mean? It means the twisting of the points. Torsades. So, what is the difference between torsades and something like VTAC or VFib? So, you see these big QRS complexes right here, and then it kind of gets smaller over here, and you'll see them right here, like the small ones right here. So, it means it goes up, and then it gets smaller, and then up, kind of twisting around this isoelectric line. All right. Now, how do we treat torsades? Well, torsades is a polymorphic VTAC, which means that it has multiple different QRS complexes. So, we kind of have to break it down into stable versus unstable. And then there's also pulsatile versus pulseless, right? So for pulsatile, pulse, so with a pulse, you're going to have stable versus unstable. So let's do stable and then unstable. For stable, we're going to go ahead and give magnesium sulfate. So we're going to give 2 grams of mag over about a 10-minute window. Now, mag, when it goes fast, can burn, so just warn the patient, hey, it's going to burn a little bit, okay? Now, what is stable on a patient? Well, stable basically means that their blood pressure is not bad, they're not super pale, they don't have massive amounts of chest pain, they're acting normally, but something has changed with that rhythm. Now, what's unstable? What's the exact opposite of that, right? Their blood pressure's low, they're pale, they have chest pain, they're not looking good, they just look bad, okay? So for unstable, we're going to use an unsynchronized cardioversion. Unsynchronized cardioversion. So what's the difference between sync and unsync? Well, the monitor has that sync button that syncs to every R wave. If you can't sync to every R wave, like in torsades where the R wave is different every single time, then you're going to have to unsynchronize cardiovert them. This isn't defibrillating them. It's just using your monitor's cardioversion doses for electricity, but doing it without synchronizing. Okay. All right. Now let's talk about if they do not have a pulse. Without a pulse, so what are we looking at here? Well, without a pulse, we're just going to go straight to a defib. So we're going to do defib, chest compression, CPR, and then we're going to do push dose magnesium. So 2 grams mag over 3 minutes, IV push. All right, so you're just going to push magnesium, you're going to defib them, and you're going to start compressions, okay? And that's the difference between unstable versus pulseless versus stable. All right, let me know if y'all have any questions.